Good day, everybody. Okay, so today I thought we were going to do the cell signaling transductase, but I did it, and then I realized that it wasn't seamless, which is what we're doing. We're about seamless understanding, so that would not provide seamless understanding. So we're going back, and we're going to do the getting through the cell membrane. So transductive. Sorry, my head is there. transport through the cell membrane. So I'm going to use the pictures that we have from the previous video in which we talked about the cell membrane and all the items that are in the cell membrane, because it's necessary to know, right, as we're going further. This is about building our foundation. So to build a proper foundation, we need to talk about how things get through that cell membrane. So I'm going to throw up some pictures, and we're going to go from there. So you're going to see this one picture because it works better, and I'd like it to be continuous. So this way, it feels like just a continuation on what we've already begun, and that will be the best way to move forward. Before I get to the picture, I want us to remember the phospholipid bilayer, where we had the water-loving head and the two fatty acid chains that do not like water, and they're called hydrophobic. I need us to remember that there is fluid. The cell is always in fluid. Excuse me. So there is going to be interactions that are going to take place in this fluid, where you have the two fatty acid chains that do not like water, where they're going to be there with the cholesterol inside. Remember the picture, so I'm going to bring the picture up and probably repeat this. Why am I reminding you? Because this is important later on as we talk more about the cascading of effects of reactions that happen from cell to cell recognition and how things come through. Right, for today we're going to talk about getting through the cell, or the transport. So it's going to be brief. All right. Okay, so what we're going to look at is one of the still images that we had last week. Now, what I'd like to say before we go to the image is that we're going to be talking about, since we're talking about how things get through the cell membrane and get into the cell. So there are two ways. And remember, we talked about in the beginning, we talked about the glycocalyx that's going to be over the top portion of the cell membranes. And then after you get past the glycocalyx, you'll have the cell membrane. Now, the cell membrane, remember we talked about it, we showed the image that we're going to repeat what we saw with the phospholipid bilayer, and we have the protein sitting throughout the cell membrane. Now, we have those things I talked about how oxygen and carbon dioxide go through the cell membrane, and that's one way. That way is without any type of energy expenditure on the cell at all, because they're small molecules and they have no charge, meaning they have this called nonpolar, meaning it has no charge. What I was going to say was that there's equal sharing of electrons, so it shows up as no charge. There's not a pole. It's not like one side gets more has more electronegativity and the other side has less electronegativity, or one side is a positive and the other side is a negative, and there's no such thing. It's called nonpolar, meaning just no charge. So the oxygen, O2, and the CO2, or carbon dioxide, they're having no charge, and they'll just pass seamlessly, effortlessly through the cell membranes, coming and going. The other portion is the charged portion, right? Now, these molecules will not just go through the lipid bilayer. It won't just go, no, no, no. So they will require assistance. The protein channel, that U-shaped one that we talked about in the very beginning before we got our still images, that's going to help to facilitate small ions like your sodium and that type of thing. That's going to just allow them to just hug it and just get it through. And remember, I told you in our last video, last week, that protein channel will sometimes close depending on what's necessary in the cell, and then open to allow, and then pass the ion through into the cell membrane. So that's that way doesn't require active energy transport either. Passive. It's just going with the gradient. So in the cell, you have your cell membrane, and there's the regular law of going from higher concentration to lower concentration. And that's how the cell manages to keep things balanced. This is how it monitors what comes in, what leaves, what's going to be allowed to come in, and what's not. It's going to be based on this gradient, who gets in and who doesn't. So now we're going to go to the image, and I'm going to talk about active, well, I already discussed the cell protein channel, so we might go over it again, we'll see. And then we're going to talk about the more active ways of getting into the cell, all right? All right, so looking here at our protein channel directly, now this is going to be where we have something called facilitated diffusion. Remember, I talked about in the last video the pore not continually being open, that it opens and closes depending on what's at the surface. Well, this is not going to require energy, but it will require the allowing. So it will not pass unless it's allowed, and the protein channel will open based on what's needed, what the cell can take, what's the gradient demands. Are we at a low? Then we'll take it in. If we're at a high concentration, then we won't take it in. And that's the facilitated diffusion. Facilitated diffusion is going to be when that wonderful cell channel, that protein channel, it will open and close based on the protein membranes. When it's open, it's going to be allowing for the passing of whatever is coming through, right? And then when it's closed, nothing's going to get through. The compound will not pass when it's closed, and it comes through again based on the concentration gradient of things going from higher concentration into a lower concentration. Now, the portion that is not going to be able to pass with no energy is called the active transport. Now, that is when we have our surface proteins. They're going to engage what we have on the outside, looking to see what's talking about. Okay, the gradient. Well, the gradient's not going to count because we're going to use energy to get what we need in through past the cell membranes that we see, past the lipid bilayer and into the cell direct, right? So that's going to consist of needing energy because it has to go against the gradient. So the three ways in which to get things past our cell membranes are through simple diffusion, like the carbon dioxide and oxygen that just comes right on through your lipid bilayer, then facilitated diffusion that comes right on through our protein channel, and then our active transport that requires energy that's going to be dealt with using our surface proteins. So active transport is important, and I'm thinking that maybe we should get a diagram just on active transport, because it's the active transport that gets sugar into the cells. It's the active transport that gets amino acids into the cells. The active transport that gets potassium, sodium into the cells. That goes against the gradient all the time. It's the active transport that that's going to be one of the ways in which we're going to start understanding and seeing how the transductase signaling I had talked about earlier, how, well, the previous videos, how it gets to get going is through active transport. Active transport is when we have those integral proteins from the previous video. We talked about integral proteins and how they stretch out and they extend on both sides, the upper layer and the bottom layer of that phospholipid bilayer that is the cell membrane. They're going to go through that integral protein, that carrier protein is going to go through changes, the structure, the appearance of the protein is going to change to conform with what it's carrying, the substance that it's carrying as it issues it through the phospholipid bilayer, as it issues it through the cell membrane and enters it into the cytosol of the cell to enable to push through the gradient and get the cell what's required for maintenance of the cell, for maintenance of the cell. For maintenance of the cell. That's it. That's how it should stay right there. So that's what that is. Active transport is crucial to understanding. So I think we're going to spend a little time. I am going to get us a image just displaying active transport because it is important, it is crucial, and it helps with our seamless understanding of how things work in the cells. And it will also get us where we need to be so that we can get to the signaling and just work on how the cascading happens without having to try and maintain like what's happening, how did it get there, what's this gradient stuff. So the gradient stuff is really simple. Things go from higher concentration to lower concentration. And that's how it works throughout all the cells. So we have the three ways in which things get through our cells. Just simple, easy diffusion. That's carbon dioxide and oxygen. Then we have facilitated diffusion, where we have our protein channel, and it's going to let in the small ions based on the gradients say so of higher to lower. Like when the cell says, okay, we're low, obviously our pore then will be open and it'll allow for the passage. It'll drop things in, right? And then when it says, okay, we're high, and it'll close up that pore, will no longer be open. And then we have active transport, where we have our carrier proteins that are going to change their shape to bring things that are needed for cell maintenance and cell survival into the cell, regardless of the gradient. And that requires energy expenditure. And there we have it. Okay. See you next week. Let me know if that was clear, or if there's something that was unclear or something we need to repeat. Please let me know. Thank you for viewing. Like this video, subscribe to this video channel, Dr. Harris channel, and I'll see you next week.